Hello everyone, welcome to ERPNext Healthcare demo. Today I will be walking you through the comprehensive features of ERPNext Healthcare domain. Today we'll be covering the use case of RYK Hospital. They are one of our clients. They are a 300 bed facility and they faced inefficiencies with managing their patient flow across IPD, OPD, pharmacy, and lab test services. This resulted in a longer wait times, there were administrative burdens, and there were suboptimal resource utilizations, and they were not able to understand the ins and outs of the healthcare management. So we at Nestaboard, we are an expert with ERPNext solutions, implemented ERPNext healthcare solution at RYK Hospital to address these challenges. We leverage ERPNext healthcare domains, its comprehensive features, and streamline their OPD, IPD lab services so that they could get a tailored and effective solution for their needs. What will be the agenda for today's video? We'll be covering all the masters that are used in ERP Next, as well as all the masters that are used in ERP Next healthcare domain. We will go through a sample outpatient and inpatient flow, along with laboratory reports and laboratory tests. And at the end, we will cover all the healthcare reports and the related reports that were customized for RYK. As you can see on this screen, ERP Next Healthcare domain was at the core of this implementation. The masters that we covered were patient. Patient is somebody who needs healthcare services. Healthcare practitioner. Healthcare practitioner is the doctor who renders these services. Practitioner schedule refers to the schedule that the doctor has. For example, weekly timings and weekend timings. Setting up medical standards and coding, for example, ICD-10 standards, ICD-9 standards, and their respective coding. Medical department refers to a department or a stream of medical department where, for example, cardiology, gynecology, urology, for specific medical needs. Healthcare service unit refers to the service unit or infrastructurally where the services are provided. For example, OPD rooms, ICU rooms, etc. These all masters are supported by ERP Next modules such as selling, accounts, stock, buying, projects, and assets to handle all the patient and their billing details as well as handling RYK's accounts and their stocks for medicine and inpatient medications, etc. These were used as a backbone to the existing healthcare domain. Now let's go through these masters in the demo instance one by one. Here you can see a list of patients, which is one of our master database to hold all the patient related information. When we click on one of the patients, for example, this patient, we will get all the connections related to the patient, like patient appointment, vital signs, if there is an encounter, if there is any surgery or clinical procedure. Does this patient need to be admitted in inpatient? Are there any lab tests or vital signs for this particular patient? Patient demographics such as the MR number, which is your reference number. These are your identification number, CNIC, and ID number. The medical department, which the patient wanted to refer to, which was the healthcare practitioner. What was the patient category? What is the patient name? Email, mobile number, all the demographic details of the patient, along with the address, customer details. So, in the healthcare settings, if we link the customer to patient, then automatically while creating the patient, a customer is created in the backend for handling billing details. Then personal history, are they married? What is their occupation? If they're related to an existing patient in the database, any allergies, any medical history, any surgical history, any medications that they're following, do they have any risk factors? So all these information along with more information that patient presents with, have heavy breathing. So these are all the details that are captured at the patient master. We can create a new patient also by adding all these details that I shared with you. This is the list of all the healthcare service units along with their occupancy status. Do they support inpatient occupancy? All the medical department. Let's see accidents and emergency. So service unit type, what is the company, service unit type and service unit name. If there is an associated warehouse, what is the occupancy status of that particular unit? Is it vacant or is it occupied? Similarly, here is a list of all the service units. Now the list of all the medical departments. You can enter all the medical departments such as ophthalmology, pediatric, neurosurgery, etc. based on the hospital needs. So RYK has all these medical departments, so we had configured it for them. Here is a list of all the healthcare practitioners, like the doctors. If you go in and enter to one of these, so for example, this is the doctor, healthcare practitioner. Their first name, what is their status? Are they active or disabled? What is their gender? If they are related to an employee, do they have an employee ID? Then the hospitals, are there any practitioner schedules for this particular healthcare practitioner? What are their consultation charges? Account details if there is an income account associated, and then the address of that particular healthcare practitioner. At the practitioner schedule master, we can set practitioner schedule for any practitioner. Here you can see that this practitioner is available from Sunday 9 to 9:25 with 25 minute slots from 9 till 11:55 in the afternoon. Similarly, for each day of the week, you can configure different practitioner schedules based on the practitioner's availability. Now that we have covered all the masters, let's move on to the OPD schedule. So now we'll discuss an outpatient flow. The outpatient flow starts with the patient booking an appointment. Once the patient books an appointment, a customer is automatically created in the backend, and then the patient visits the hospital. The hospital staff, the nurse takes the vital sign of the patient, then they create an encounter, and then they bill the patient. So we'll go through all these steps on ERP next to understand how this journey happens in the software. Here you can see all the patient appointments which are open. So you can add a new patient appointment. Here you have to give the patient detail, healthcare practitioner, whatever department, mode of payment. Once you add all these details, automatically the practitioner name department gets populated. You can select the appointment type as consultation, the duration as whatever duration. Then you can check for availability. Once you select the date, all the availability for that particular date for that doctor comes up. As you can see, 4 o'clock is not available for this particular doctor, so you can book a 4:30 slot. Once you book, an appointment is automatically created in the schedule section. And from that appointment itself, you can create vital signs and an encounter from right here. So for this particular appointment, Bharti, we have already created the vital signs. So vital signs are taken to note the vital information about the patient's condition when they enter the hospital. For example, body temperature, reflexes, heart rate. All of these are entered when they visit the hospital. The height, then their weight and their BMI is already automatically calculated to understand their health risks in the notes. Once the vital signs are taken, then a patient encounter is created. We can go ahead and create a patient encounter from right here, where all the details will be pre-filled. Encounter means that the patient is now visiting the doctor. You can write all the symptoms, the diagnosis, if there is some medical coding, medications, some investigations that you have to suggest, or some clinical procedures or some therapy. All these details you can write in the encounter. For example, this particular encounter, here are the details. So this patient is basically an OPD patient, and you can see all the details. In the sales invoice, you can see all the status of the sales invoice. Are they paid? Are they due? For example, Bharti. You can also add a new sales invoice. Here you have to write the patient's name. Once you write the patient's name, all the other details are populated automatically. Then, if there are other details that you need to add, and all the items. So from here, get items from, you can fetch items from healthcare services. So you can see there are multiple healthcare services for this particular patient along with lab prescription. So we can select whatever service we want to bill for, and that will be automatically added in the items. If there is discount, that will also be added, total quantity, and the total amount will also be added. We can click save, and the sales invoice will be saved, and on submitted, the sales invoice will be added to the accounting, and it will be submitted in the unpaid status. Once the customer makes the payment, we'll record the payment. We'll add the reference number. We'll add the mode of payment, cash, and other details, taxes and charges if there is any write-off amount. And now we'll submit this payment entry. On submitting this payment entry, you will see that the status of the invoice changes to paid. Now it has changed to paid. So this was all the end-to-end flow for an outpatient department. Now we will cover the inpatient department. For example, the patient which came for OPD, one of our patients that came for OPD, from here schedule admission, we can convert this patient from OPD to IPD. It will ask us the medical department admission ordered for the date, and if there is a healthcare practitioner which is secondary, what will be the service unit type, where will the patient stay, what is the expected length of stay. So if there are any instructions, once you click order admission, the patient will now turn from OPD to IPD. An inpatient record will also be created for that particular patient. Here the admission is scheduled for this particular patient. What are the admission order details, which is the primary practitioner, all the details that we mentioned, what are the encounter impressions, what are the medications, any investigations, any procedures, all that will come in. From here only, from the encounter, we can also create inpatient medication orders for this particular patient. If there are scheduled medications that need to be done, so you add a medication order, you select the drug, you select the dosage, you select the period, and then the dosage form, what is the dosage form, and then you add that. So as we were discussing in this, the patient is admitted into the hospital. It can be an OPD transfer or it could be an emergency admit. Then the practitioner is assigned, then the nursing unit is assigned, then the treatment plan is decided like I showed you on the screen. And if there are any transfers from, let's say, ICU to some other ward, we do those, and then you discharge the patient and bill the patient. If there needs to create a vital sign or a medical record or a clinical procedure, from here only, from the inpatient, we can create a procedure and the procedure template. For example, there are different surgeries or minor operations. We can select that, and these will be noted. Whatever consumables will be there in that particular procedure, they will be added. From here only, if you want to see patient history, you can just see the patient history. What were the vital signs today? What was the encounter, the clinical procedure on this patient? All that history is updated in the patient history section. Once all the clinical procedures are done and the patient is ready to discharge, you can just schedule discharge from here. You can add instructions in the note, and if there is some other notes, if there is a follow-up date, you can add a follow-up date, and then you can order discharge. So now you will see that the patient has been discharged. So if you want to bill this patient, again, we will go to the sales order. We will go to the sales invoice. Here we can get items from healthcare services. Here all the charges will come up and you can add these charges. If there are any drugs or prescriptions, that you can also add, and then you can save and create a sales invoice. Now we will go through laboratory management. So, for example, if a test is prescribed to one of the patients, then the test is logged in the system, a sample is collected, and then the tests are conducted, and the reports are given to the patient. Here you can see a list of lab tests. You can also add a lab test for a patient. You select the test template, you select the patient, you add the requesting practitioner. Are there any comments, custom results? If there is a different type of print, you can also get tests from patient encounter, and then save. Now the test is marked as pending. Then you have to approve or reject this test. So once you approve the test is approved. You can send SMS to the patient that your test is scheduled. Right now that's not configured. You can create a sample creation for that particular test. So you select the patient and then you name the sample, the type of sample, what is the quantity, who was it collected by, when was it connected, and you create the sample slip for noting down the test name and the sample name. So in the lab test, you can see the lab test reports, or you can see the status, department, who was the patient, who was the practitioner, lab technician, and this report is also sent to the patient. Now that we have covered the lab tests, we will go through all the reports that we custom created for RYK and some of the reports that were already present in the system like patient appointment analytics. Let's go through them one by one. Here is the report for total daily outpatient count, total patients that were admitted like the inpatient count, and the total patient count. So this report gives you a view of how many patients were treated in a day and what is the increase since yesterday. So it's helpful to understand. how many patients are admitted and how many are discharged and how many are pending discharge. This report gives you for each healthcare practitioner how many appointments were there in total. So you can take it by healthcare practitioner or medical department. So by medical department, you see that from July there was just one. And then if you do it yearly, you can see it for all the medical departments. You can select the start date if you want to see it for more than a year. You can select the start date and then you can see how many based on medical department, and here you can select, if you select all the departments, it will give you all the appointments for that particular week or a month. That way you can understand which department is going well, which department is getting more patients for analytical view, as well as you can do it based on healthcare practitioner also. Which these are the healthcare practitioner codes, how many appointments were there for each of them. The last is the lab test reports. Here you can see from a particular date to and from date how many lab tests were configured, were suggested, how many were completed, along with who they were, what were the patient, what were the company, patient name, lab technician, what is the status, how many of them were billed, how many were approved, all the information about the lab tests. Also, this is the last report for the inpatient. So here you can see how many were admitted and you can filter it based on company. You can add other filters also and you can refresh it. So how many were discharged, how many were admitted, and for how many the discharge is scheduled. So this is the end of the demo. Thank you everyone.